Hello, my name is Kinsey, and this is my head-to-toe video. Hello, my name is Kinsey. I'm going to be your student nurse today. I'm going to wash my hands and provide privacy. Can you tell me your name and date of birth?
Micaiah Duckett, 0804-1999.
So I got my 2 patient identifiers, and I'm going to check the order and verify that I have an order for head to toe. So we're going to be doing a head to toe assessment, so I'm just going to be checking you out. Is that okay?
Yeah.
Okay. Do you have any allergies?
No.
Okay. Can you tell me where you are?
In your room.
Okay, can you tell me what day it is?
The 28th of April.
And what are we doing?
Head to toe assessment.
Okay. So that means that my patient is oriented with these questions. She's oriented to herself, place, and time. And I'm also assessing her mood, which is she's like calm, cooperative, and alert. All right. So now I'm going to take her vital signs. So for blood pressure, systolic pressure should be between 95 to 140. Diastolic should be between 60 and 90. Her respiration should be 12 to 20. Her pulse oximetry should be between 95 to 100%. Her pulse rate should be 60 to 100 beats per minute. And her temperature should be between 97.7 to 98.8. Those are all normal ranges. Okay. So now I'm going to move on. Can I feel your head? So I'm assessing for any bumps or lesions, checking for symmetry. Thing looks good. Now I'm going to move on. Do you wear any glasses or contacts?
Yes.
Do you have any issues with hearing or wear hearing aids?
No.
Okay. Can you pull up your glasses for me? So I'm just checking for pupil constriction and dilation. Okay. And now can you follow this for me?
Mm-hmm.
Okay. Go up. Okay. So when I was checking for her pupils to constrict and dilation, I'm assessing for PERLA, which is pupils are equal, round, reactant to light, and accommodant. And I'm also assessing cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. Okay. Now I'm going to check the patency of her nares. Now I'm going to occlude a nostril. Okay. And I'll also assess her eyelids. When I assess the eyes, I would assess her outer eyelids and her eyelashes and make sure everything's symmetrical. Alright, now I'm going to check her mouth. Can you say "ah" for me? Okay. Checking to make sure that her palate rises symmetrically and that her gums look good and pink. There's no lesions. There's no broken teeth or anything like that. And that's assessing cranial nerve 9, the glossopharyngeal. And if I had to order for a gag reflex, that would be cranial nerve 10, which is the vagus nerve. All right. Now we're going to move on to your shoulders. Can you shrug for me? Okay. Can you turn against my hand? That's assessing cranial nerve 11, which is the accessory. She's sitting up for me, so I would check for jugular vein distension. And then now I would palpate the carotid artery one at a time on each side. And then I would listen with the bell on my stethoscope. Listen here and here. And normally you could hear S1 or S2. And if you heard any bruise or swishing, that would be an abnormal finding. Okay, now we're going to move on down to the arms. Can you put your wrist out like this for me? So I'm going to check her radial pulse. So I'm counting, would check for symmetry. I would be checking for the rate of 12 to 20, rhythm regular or normal, and amplitude of 2+. Okay, now I would assess for cap refill, so I would squeeze all 10 of her fingers, making sure there was cap refill within less than 2 seconds. Okay, can you close your eyes for me? Can you tell where I'm touching you? Tell me where I'm touching you.
My right arm.
Okay.
My left upper arm.
Okay. Cool. All right. Now we're gonna move on down to the chest. So I'm checking her AP diameter, which is a 2-to-1 ratio. The chest is twice as wide as it is deep. And then I would listen for lung sounds. So I'm assessing for the rate, rhythm, and depth. So I wouldn't want the depth to be too shallow or too deep. And rate would be 12 to 20. Okay, so I count her respirations for a full minute and assess those. Now I'm gonna listen. So I'm gonna listen here, 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 and then over to the sides. Sorry. Here. Now tell her to take a deep breath with each placement, and I will listen to her back. So here, here, and here. Alright, you can go back and down. I would listen, making sure that the lungs are clear. I wouldn't want to hear any wheezing, bronchi, or stridor, anything like that. Alright. Oh, now we're going to move on to the heart. So I would palpate the mitral, which is right down here. So I'll palpate and feel for rate and rhythm of that. So rate being 12 to 20, amplitude being 2+. Okay, now I'm gonna listen. So I would listen on the second intercostal space on the right side. This is the aortic. S2 is louder than S1 here. And then I would move over to the second intercostal space on the left side. This is the pulmonic valve. And S2 is louder than S1 here. This is second intercostal space. And then I move down to the third intercostal space. This is Erb's point. S1 and S2 should be equal here. And then I move down to the tricuspid. This is the fourth intercostal space, and S1 and S2 should be equal. And then I move down to the fifth intercostal space, and this is the point of maximum impulse, which is the mitral valve. And this, and S1 should be louder than S2. Okay. So I'm assessing for rate, rhythm, and amplitude of the heart. Rate should be 12 to 20, rhythm should be regular or normal, and amplitude should be 2+. Okay. Now we're going to move on down to the abdomen. So I would make sure that the abdomen is round and not distended or anything abnormal. I would listen for bowel sounds. There should be 5 to 30 bowel sounds per minute. And if I don't hear any bowel sounds, I'll listen for up 2 minutes and could be listened for up to 5 minutes to be able to see if I could hear anything. So I'm going to listen in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And then I would palpate. So palpate the abdomen, feeling for any masses or anything like that. Was there any pain with that?
No.
Okay. Can you, urine, do you have any issues with urine retention or incontinence?
No.
Okay. Do you have any, when was the last time you had a bowel movement?
Yesterday.
Okay. And if there was any pain throughout this entire assessment, I would ask my patient the character of it, the onset, location, duration, exacerbation, if there's any relief factors, if it radiates, and the severity of the pain. On a scale of 1 to 10, 1 being the least pain, and 10 being the worst pain that you've ever felt. Okay, now I'm going to move on to the femoral artery. So I would feel for the femoral artery in here, assessing for symmetry, rate, rhythm, and symmetry, rate, and rhythm. Okay, so symmetry. So rate being 12 to 20, rhythm being normal, and amplitude being 2+. Okay, now we're going to move on down to the legs. I would do cap refill on all 10 toes, and I'm going to listen to my pedal pulse, listening for symmetry, rate, rhythm, and amplitude, and then my posterior tibial pulse, which is in the inside of the ankles. Okay. And now I'm going to ask, can you push for me? Can you pull? Can you close your eyes and tell me where I'm touching you?
My left leg.
Okay.
My right upper leg.
All right. Can you stand up for me? All right. Can you go one leg out to the side and do the other leg? Can you go like this with each leg? Okay. So I'm assessing strength. My patient can stand up, so it's good. You can go ahead and sit back down. Can you roll your ankles for me? Okay. And can you roll your wrists for me? Can you bend your elbows like this for me? And then can you go out to the side? Okay. So I'm assessing the ankles, the knee, the hip, the wrist, the elbow, and the shoulder. So range of motion looks good. So throughout my entire assessment, I assessed the skin. So I'm looking at the moisture, the temperature, the color, and assessing for any edema. I'd also assess for any IV sites or invasive lines, any lesions, wounds, anything that's abnormal that I need to check out. And then I would, at the end of my assessment, I would do a Braden scale, which is if it's between 18 to 23, it's normal, but anything below 18, my patient is at risk for pressure ulcers. And that is my head to toe.